Okay, welcome everybody. Glad to, well, I won't be able to see you, but glad to have you present during this presentation. So, as you know, the title is Incorporating Therapeutic Touch into Practice. So I've been invited here by the Canadian Holistic Nurses Association, and Langara College is facilitating recording this for us. So here we go. So I just thought I'd first share a little bit about myself so you know who I am. So I'm a founding member of our BC organization, BC Therapeutic Touch Networks Society, and I'm currently our past president. I've been president of the Therapeutic Touch Networks of Canada, which we're going into our 5th year. I'm a Therapeutic Touch recognized practitioner and recognized teacher, and the QTTP and QTTT is the same designation. It's Qualified Therapeutic Touch Practitioner and Qualified Therapeutic Touch Teacher, which is the Therapeutic Touch International Association designation for the same thing. I've been member of the Therapeutic Touch Dialogues, giving input into the theory of healing, which I'll just briefly touch on a little bit later. I've been a primary investigator into the research study efficacy of therapeutic touch in the treatment of pregnant, chemically dependent hospitalized women, which was conducted at BC Women's Hospital. And I developed the Langara College Therapeutic Touch Practitioner Certificate Program, which again I'll talk about a little bit later. And so I've been doing therapeutic touch for about 28 years, and I'm very passionate about it. I feel it's a part of me. And one of the things I'd like to do today is just to share with you some applications for it in different settings. So just to give you a definition of what therapeutic touch actually is therapeutic touch, we also just abbreviate that to TT, and it's a holistic evidence-based therapy that incorporates the intentional and compassionate use of universal energy to promote balance and well-being. So I just have this slide. This was a picture that was in Nursing BC in August-September issue, 1993. And I really liked how you could see kind of the image of the energy coming off the hands. So some of the benefits of therapeutic touch. So there's been a lot of research done on therapeutic touch, and so some of the most common things are promoting deep relaxation. That's effective in probably like 90%, over 90% of people. Relieving stress and anxiety, again, tons of different studies showing that. Minimizing or eliminating pain, supporting the immune system, promoting feelings of calmness, peace, and well-being. So one of the things I wanted to address today is some people's perceived barriers that they have. So people will say, well, I'm not really comfortable doing therapeutic touch on patients or clients, or I don't have time to do a full 20-minute session. So what I'm saying is if you lack the confidence, then really just practice more. Practice on your family and your friends, go to a practice group, and once you develop this skill, you'll really see the positive results, and you'll just want to use it all the time. So when I first started doing therapeutic touch, that's a long time ago, and I really didn't tell a lot of people I was doing it when I was working in the hospital, and I was very careful of who I told about. And then once I really saw just such great positive results, I just really felt that I had to share it more and talk about it. So it's really developed from there for me. So obviously a complete therapeutic touch session is always the optimum, but a partial session can be really effective, and even 1 or 2 minutes. I've done therapeutic touch on a colleague in front of the cafeteria when she was running one way and I was running the other, and I said, hi, I hadn't seen her for a long time, so I said, how you doing? She says, I've got just such a bad migraine headache. I said, let me do a couple minutes of therapeutic touch on you. She said, it's so busy, I have to get back to the unit. I said, okay, 2 minutes, give me 2 minutes. So I'm standing in the hallway and I'm just doing therapeutic touch on her head. And she said, oh, she had been seeing spots in front of her eyes and, had a headache and was a little bit nauseated. And she said, she described it as almost a miracle. She said it's like it's gone, and she couldn't believe it. So I'm just saying, sometimes we limit ourselves by thinking we have to do this longer session. And really, that's one nice thing about therapeutic touch is even a full session can be like 20 minutes or much shorter, even depending on the condition of the person. So it's really great that you're able to do something in a shorter period of time. So again, some of these things I've written more than once because I think they're really important. So again, if you're lacking confidence, just get out and do it more. And if you're comfortable doing it on your family and your friends, then you're more likely to be comfortable doing it on patients. And just so you know, too, the therapeutic touch is within the scope of nursing in BC and in Ontario, I believe, as if you have the proper training, of course. And so that's really encouraging too. So if you don't have time for a complete session, then do what you can. One of the things that you can always do is center yourself, and that is so important. So if you're not familiar what centering is, it's just getting yourself calm and still and going into that heart space within yourself, bringing in that universal energy, thinking of it, circulating and going into the ground so you're solid and you're quiet and you're able to really listen to any cues you're picking up from the other person's field, and just allows you to be really present for each person. So one of the things that I found, an example of when I found that really, really helpful is one time I was working in maternity, and one of my colleagues had just had a baby. And at that time, I was going in between units, so I didn't, I was casual, so I wasn't working on one unit all the time. I worked on lots of different units. And I came on a day shift, and this woman asked me if, she asked the charge nurse if I could look after her that day. And she had all of her buds on that unit and everything, so I was a little bit surprised, but I said, yes, sure. So when I went into her room, she said, I bet you're wondering why I asked for you to be my nurse. And I said, yes. I was kind of curious. And she said, I'm really not expecting anything to go wrong. I know I don't have any real risk factors or anything, but she says, I know if something did go wrong, you would be calm and deal with it, as best as it could be dealt with. So just that idea of that calmness, really, it can be so reassuring to people. And it can be catchy. So if you've got, I'm sure everyone's probably been in a situation, if you are calm, people will tend to become calm. If you are anxious, people will become more anxious. So really can't stress the importance of centering yourself. So the other thing is really incorporating therapeutic touch into the care you're already doing. So again, centering yourself before you see each patient, so that you are there, even if you're running around like kind of craziness happening, and you only have a minute or two to go in. Just take a minute and take a couple deep breaths, center yourself, and be present for that patient when you're there, so you can really hear what they're saying to you and act accordingly. So when you're doing your assessment of them as well, just consider taking 1 minute to do an energy assessment when you do your physical assessment. And that can be really super helpful. So it can give you more information. Sometimes people just aren't able to communicate properly for whatever reason. Maybe they're in pain, or maybe they have other issues happening. But that can really help you out. Another thing is, an example of doing it is doing it when you're doing a dressing change. So, you can be doing this, even if it's with your intention. Of course, you can use your hands to do the therapeutic touch, but you can also do it with your intention as you're doing these things. So you can unruffle or clear some of the energy out as you're taking off the dressing and assessing it. You can be sending energy as you're cleaning, and also when you're putting the new dressing on, that dressing can be soaked in this healing energy. So it's really helpful. And sometimes it's like you can really see that wound pinking up, and from day to day you can see quite a significant change. My father-in-law had peritonitis, and he had open wound probably about 5 or 6 inches, so on either end of left open, just so that the infection could get out. So I think some of us might be having technical difficulties, but I'll just carry on, I think. We're carrying on.
So there's feedback. So if you could just remind everyone to turn off the microphone.
I just turned
Okay.
off.
So if anybody has their microphone on, if they could turn it off. I guess some people are getting a little bit of feedback. So I'll just carry on, and hopefully that will be worked out. So anyway, with my father-in-law, as I say, it's important to leave that incision open so that infection doesn't get trapped in there if it's sutured up. And as I say, I would do his dressing every day, and as I say, you could almost see from day to day a difference as it healed and it grew together. And if there was a day that I couldn't do it, I could notice a difference between when I had and when I hadn't. So it is really amazing. Another application is when you're starting an IV. Lots of times people have difficult veins and it's hard to start. So of course, you put the warm compresses on and stuff and tap the vein. But if you just do a little bit of therapeutic touch on that arm and on that site, it can really help for that vein to relax and to be able to get into that vein, even if they're difficult. One of the neatest things for me was one time, again, working in maternity, this woman had no risk factors. She'd had her baby about 3 or 4 hours later, or 3 or 4 hours previous, and she was on the maternity ward, and all had been fine. And then out of the blue, she just went unconscious. So, nobody really knew what was happening. Of course, she had difficult veins, so they wanted to start an IV right away. The anesthetist was up, attempting to start the IV. And this poor woman, of course, had a needle phobia, so she was just in total panic. And she was totally against having another IV, and she was trying to rationalize that she wouldn't let this happen again, etc. So the anesthetist was on one side of the bed, and her husband was on the other side of the bed. And I came in to help out, and I was just at the bottom of the bed by her feet. So I was just doing therapeutic touch on her whole field, but I was just at the bottom of the bed, as I say, just working physically from the knees down, and I was stroking her legs with the intention of sending her calmness and peacefulness. And I was talking to her the whole time and explaining what was happening and why we were doing it and all this kind of stuff as well. But the whole time I was doing therapeutic touch. And the anesthetist was having quite the time trying to find another vein to start the IV. And by this time, it was quite a bit after my shift, and the next shift had come on, and they were coming in and they were making sure she was okay as well. So I decided that it was time for me to leave. And I explained that to her, that she was going to be okay and it was time for me to leave. And so she was quite calm at that point. But I just got off of the bed and was just leaving, and as I was getting off the bed, her husband moved from his chair down to the bottom of the bed and sat on the other side, and he continued to do therapeutic touch. It was just the most amazing thing I've seen. It was just totally seamless. It was like we were totally one. And he carried on. I don't know that he knew anything about therapeutic touch, but he certainly picked it up very quickly. And it was great. She remained calm and she felt safe, and all went well after that. So that was really encouraging. So other applications is uh, a lot of my experience has been in maternity, so there might be more examples of maternity, but really, many of these things you can apply to various different situations. So when I was in maternity, often when people have a difficult delivery, their perineum and their bottom is quite swollen, and sometimes the first time it's very difficult to void or to pee. So I would do therapeutic touch on them, and uh, it it always worked for me, always, always. And it was kind of funny because sometimes if I go on the unit, one of the other nurses would grab me and say, "Okay, I need you to do therapeutic touch on so and so," because after nurses says have lots of tricks to get people to pee, but once all those are exhausted, then it's time for a catheter, and of course nobody likes that. So again, an example of that is I had a patient, well, it wasn't my patient, it was this other nurse's patient. She grabbed me as I came on the unit, and she says, "Mrs. So-and-so needs, I'm going to have to do a catheter on her. I was just going to do it." And so she said, "Why don't you do therapeutic touch on her?" So I went into the room. The lady has 4 or 5 visitors in there in a double bedroom, so it's very crowded. And she speaks no English, and nobody else who was with her seemed to speak any English. I have a feeling that she might have understood some, but I don't think she definitely appeared to speak no English. So with sign language and everything, and pointing to my watch, I said, "Can I have 5 minutes, and I'll just try and do therapeutic touch with you, and hopefully you'll be able to go pee." So she kind of nodded. So as I went to start, everybody except for one woman went out of the room, and it seemed to be like either her mother or mother-in-law, and I think she was kind of there to make sure that I wasn't going to be doing anything too weird to this woman and that she would be safe. But after I was on doing it for about a minute or so, then this mother or grandmother type, she left, and there was just the two of us there, and I was doing the therapeutic touch. Only about a
Recording has
minute or two
started.
later, she's going, like, putting her hands up, like, "Stop, stop." And I'm pointing to my watch and I'm saying, like, "Just give me another minute or so." And she's like, "No," she's like, having her hands up, "Stop, stop." And she gets out of the bed and she goes to the bathroom. And of course she just pees and pees and pees. So, and another example, by the time you go and get the catheter and get prepared, you could be doing something which would take you just 2 minutes, and of course way less invasive to the patient. So great thing to be able to do. And so you can use that in so many different situations. Sometimes when people have surgery, they have the same problem. So again, another thing is doing therapeutic touch when people have a paralytic ileus, or when they have surgery. Often afterwards they're not able to pass gas or have a bowel movement. So this is another time. So again, in maternity, this doesn't happen very
Recording
often
has
where
stopped.
you need to intervene in that case, but there's 2 different situations where that happened, and they were going to put a nasal gastric tube down the person so to relieve some of the pressure. So again, nobody likes that. I don't care how good you are at doing a nasal gastric tube, it's horrible. So I would do the therapeutic touch. So with both of these women, the doctors had come into the room and said, "Okay, one lady, he had said, I'll be back in about an hour. If nothing's changed, we'll be doing the nasogastric tube." And the other lady, he had said he'd come back later in the day. So both of these women, I did therapeutic touch. You could actually audibly hear the bowel sounds, and they really felt the bowels moving, the air moving in their bowels. And both of them were able to pass gas, and neither of them needed a nasogastric tube. So again, by the time you go and get the equipment and do it, you can have done therapeutic touch, which is far less invasive and way more comfortable. And the patient likes it way, way more. So other applications in preterm labor, I used it a lot in preterm labor when people uh, were high-risk antepartum and they'd be uh, in the hospital and they go into preterm labor. So if I did therapeutic touch, it would just relax, and often it would just stop. It would slow down almost immediately and then stop. So other things as far as pregnancy, to dilate the cervix, really, really helpful for dilating the cervix. Also for transition of labor, sometimes when the baby just needs, so the fetus just needs to move a little bit and then things will progress. So again, not myself because I didn't work in labor or delivery room, but a couple of the people that I taught, they said that they did it when they were just about ready to have a cesarean section because really nothing was happening. And then they did a therapeutic touch. The baby just moved a little bit and everything carried on, and they didn't need to have a cesarean section. So huge, huge application there. With breastfeeding, of course, I think most people know that whether when the mom is upset, the baby is upset. If the baby's crying, the mom is going to be upset. So doing therapeutic touch is really, really calming and really helps with the breastfeeding. Because of course, when you're first starting to breastfeed, everything is new. Lots of times people have never done it before and they're really anxious. And of course, the babies are really tired. So, they're not always knowing what to do either. So this is really, really a positive thing. Also, it really helps with the letdown reflex, as you can imagine. And it also helps if people are using are pumping, if their baby's not with them, or even if the baby is with them, then if you record when therapeutic touch is done, you will see that they pump more volume after the therapeutic touch, and then it continues to decrease till the next therapeutic touch session. So again, that's so helpful. Sometimes when moms have their babies in the special care nursery or something where they're separated from their baby, it's much harder for them to pump. And so, they're very, very appreciative of that. Pain control, really super helpful with pain control. So research has shown that people need less pain medication, or the pain is less intense and they can go longer before they need pain control medication. So it's not that we're advocating not to give people pain medication. Obviously, they need it for sure, and if they're requesting it, absolutely. But just that people are finding that they don't need it as frequently. So that's wonderful, one less thing in their system. Anxiety, like I talked about with the woman with the needle phobia, it's so fabulous. And in so many different circumstances, you can do it. So people who are anxious, people with mental health issues, panic attacks, so many different circumstances. It will really, really help if you just take that moment to center. And you don't even have to go up and do anything. You can just totally use your intention, and you will find that they really start to calm down. And this is so good whether you're in the hospital or whether you're in community. I had a colleague, and she saw somebody. She was in Vancouver on Grouse Mountain, and this woman was going to go I don't know if it was up or it must have been up the gondola, I guess. And she was just having a panic attack. So she went up to her and said, I know something that might really help. And she did therapeutic touch, and the lady went up in the gondola, and she saw her later afterwards, and she was so appreciative. So many different times and circumstances where you can do that. I did it one time when I was in a bowling alley. The man who obviously had some challenges, and he was getting more and more agitated. This man, he certainly wouldn't have done anything intentionally to hurt somebody, but when he got more agitated, he would put his head down, and he was a really quite a large man, and he sort of just charged through people. And so, uh, back in the old days when you actually kept score for people, that's what I was doing. I just put my pencil down and I just sat quietly and set a calming energy and calm right down. So, as I say, so many different applications. For people with limited movement and mobility, uh, you do therapeutic touch with the intention of fluidity of movement. So I've used this a lot with people who have arthritis, for people who have frozen shoulders, and it really, really helps immediately. So after you're doing the therapeutic touch, you want them to move that joint or move that area, and they'll say to you, well, I could only lift my arm this high before, and they can move it higher after the session. So the things there. In rehab, I've taught therapeutic touch to physios and occupational therapists, recreational therapists, and they have used it when they're putting on splints to help that limb relax so that they can fit it better, and it will aid the person more. It's great after surgeries. I myself have had a total knee replacement, and I used it on myself a lot, and I had a lot of people sending me therapeutic touch as well. And when I went to physio, the physiotherapist said I was probably one of the best uh, as far as recovery. I was recovering faster than just about anybody she'd seen, and I totally believe that that was because of therapeutic touch. So really wonderful like that as well. You can tell I'm passionate about therapeutic touch. I think everything about it is wonderful. So aids in clearing toxins or meds out of the system, after surgery or anytime I used it, well, that was what my research study was on decreasing symptoms of withdrawal. And we had statistical significance that it decreased anxiety, and we didn't have statistical significance on decreasing symptoms, but many, many people reported decreased symptoms of withdrawal. They were able to sleep better, they were less jittery, they had, some people described it as less cobwebs in their head. So wonderful for that as well. Chemotherapy, many people use it for decreasing symptoms of nausea and vomiting. So that can be in any case too. So it doesn't have to be in chemotherapy. Again, I've used it when people are pregnant and they're having a lot of nausea or vomiting, or if you're not feeling well, you have the flu. So many applications for that as well. It's interesting, one of our therapeutic touch practitioners was in having chemotherapy, and the lady next to her, they were having difficulty starting her intravenous, and so she was doing therapeutic touch and telling the nurses how to do it. So again, so many applications. So whether you're a patient or whether you're a practitioner, and in that role, you can do it. Hospice, we have so many hospices that use therapeutic touch, and really it is so wonderful in just helping people to feel calm and peaceful. And again, many people describe that clarity of their mind. So sometimes, again, people are finding that they don't need to take as much medication. It's, pain medication is absolutely wonderful, and you don't want to be in pain. But when you're dying, you do want to be present, and you do want to have some clarity and make those final decisions and speak to people. So it's so wonderful to be able to have that in that situation as well. And also just some of the symptoms that they might have in addition to pain, like difficulty breathing and agitation, and those can really be helped as well. In an emergency, it's great. You're in the middle, you can have no equipment, you're in the middle of nowhere or uh, different circumstances and be able to do something. So I've done therapeutic touch in the middle of a hockey rink. I've done it in middle of a huge banquet hall and, with a couple hundred people around. And it's so wonderful to be able to do something that is helping the person and helping the people around them to remain calm and peaceful as well. So wonderful there. Uh, to increase sensation or decrease annoying sensations. So I've done therapeutic touch on a woman who was paralyzed uh, pretty much from the waist or a little bit higher than the waist down. And she reported after I did therapeutic touch that she could feel her feet, her toes, just like before she had had the accident that paralyzed her. So she reported that this happens rarely. It has happened before on rare occasions, but it certainly happened immediately after I'd done the therapeutic touch. And that was a really neat sensation for her. Also, things like when people have MS, as an example, and they have that pins and needles, really helpful in decreasing that sensation and again, going back more to a normal feeling. Stabilizing vital signs. So therapeutic touch is great at decreasing respirations, decreasing heart rates, lowering blood pressure. And there's been studies done even when babies are premature, and they found it's very safe and it just helps to stabilize them. So especially with these little tiny infants, it's so nice to be able to do something that is so uh, non-invasive for them. I already talked about calming and clearing the mind. Again, in hospice or when people have a debilitating condition, it is so helpful for them to give them a little bit of hope and the ability to be able to function. When I was at Orcas, Camp in July is a place where people go to do therapeutic touch. They have an invitational workshop there once a year. And I was there, and there was a gentleman who came as a patient, and he was a very tall man, very, very nice, and he had been a surgeon before. And he had come with his wife, and the introduction, when we all did our introductions at the beginning, he had talked about how he was a surgeon and he had Lou Gehrig's disease, ALS, and he was saying how he was quite skeptical. He really didn't know a whole lot about therapeutic touch, but one of their friends had really encouraged him to come. So he had come with his wife because at that point he was having difficulty dressing himself. He really had a hard time with buttons, and he was starting to have a hard time holding like a fork to feed himself. And so this program, we were there for 5 days. And at the end of the 5 days, he stood up and he just said he wanted to thank everybody for the support that everybody had given him and all the wonderful therapeutic touch sessions he had received. And he said one of the things that he had been able to note is that he was able to move his finger more. And he said, you might not think that's a really big deal, but he said, for me, it means I can feed myself. And he said, I also have some hope of being able to cope with this. He says, I know I'm going to die. I know this is a debilitating disease, but he says, I have some hope in how I'm going to manage it. So that was so wonderful. And both he and his wife were so much calmer, and they would laugh once in a while. You'd hear them laughing once in a while, which, of course, at first there was none of that. So, so wonderful to be able to give people hope. It can be used with counseling. So I have taught social workers and chaplains, and they often use it with their counseling sessions. So either doing it as they're counseling or before or after they're talking with people. So again, just so wonderful with that. Also, you find when you're doing therapeutic touch, the words come out so much easier. And so often they're more meaningful to the person. So the other thing is therapeutic touch can be taught to family, and it gives them something meaningful to do for their loved ones. So once I was actually my sister-in-law ended up in intensive care unit, and she was in a room that was surrounded by, it was a glass room, and of course they can close the curtains if they want to, but often they were open. And there was a young man in the room next to her who had been in a very bad motorcycle accident. And he was totally unresponsive, and he'd been unresponsive for like 6 days. And there were several of us who would visit. And so usually there'd be like one or two of us in with her at a time, and the rest of us would be out in the waiting room. And when I would go in, I would do therapeutic touch with her. And one day I was back in the waiting room, and this woman who I hadn't really talked to or anything before, she said, "I noticed that you were doing something in there, like with my sister-in-law." And she said, "I was wondering, is that therapeutic touch?" And I said, "Yes, it was." She said, "I used to do that a long time ago," she said, "and I'm going to start doing that with my son." So this was her son who had been in this bad motorcycle accident and been totally unresponsive. And so anyway, it was really neat because it gave her something where she was doing something for her son when nothing else had seemed to have been working for him. And the next day, I didn't see her after that. My sister-in-law left the intensive care. Thankfully, she recovered. So that was really wonderful. So I didn't see this woman ever again, but I overheard uh, the medical staff talking, and this young gentleman beside her had started to move his feet. So and she had been doing the therapeutic touch. So that was such a wonderful experience as well. I just thought that I'd show a couple of pictures here. First picture is Marjorie Anderson doing it on a patient, and you can see that. So you can do it in the hospital or clinics, of course. And then one of our other listeners, Linda Harvey, another colleague, she is also doing therapeutic touch. So again, you can do it in all kinds of different circumstances. So we're going to the teaching aspect of therapeutic touch. Therapeutic touch has been taught in so many places: hospitals, hospices, healthcare facilities, many colleges and university and schools, and so many different places. I've taught it to uh, recreation aides and daycare facilitators, and so many different. So I just thought I'd just give you an example. This is by no way complete in any means, but just some of the places that it has been taught in Canada. So Dalhousie University School of Nursing, MacEwan University, University of Lethbridge, Queen's University, Central Okanagan College here in Kelowna, Langara College here in Vancouver, and as I say, many other places as well. So I just wanted to talk just briefly about the Langara College Therapeutic Touch Practitioner Certificate that we have here in Langara. So we developed this to support the BC Therapeutic Touch process to become a Therapeutic Touch recognized practitioner. So it's a really comprehensive program. It's definitely the first program of its kind in BC, and to my knowledge, it's the first program of its kind in North America. The only program that is all similar is a diploma program in Australia, at least to my, at least as far as I'm aware. So for this program, the students can take the classes individually if they choose, or once they have completed all of the courses, then they can apply for a Langara College Therapeutic Touch Practitioner Certificate. So it's really nice for people when they don't know if this is a fit for them, if this is something that they want to do, so they don't have to have this huge financial and time commitment up front. They can take a course, and if it fits for them, if they're liking it, if it's helping them, they can continue. So the course includes the 3 levels of therapeutic touch that we have here in Canada. It includes a therapeutic touch mentorship program. So this is a year-long program where students come. We meet usually the first Saturday of the month for 4 hours. We have a lecture, discussion, practical exercises that we do for the first hour and a half or so. We have a short break, and then we do 2 therapeutic touch sessions. And so we have been in different locations. This program has been around for, it's just a year now, and we have done a clinic situation where clients can call in and book a session, and currently we are at a long-term care facility, and that's been really neat too. And as each month when we go, you can notice a difference. So the noise level goes down right away, and people who are aphasic, who can't communicate, you can just see them relax. They look into your eyes, and they're definitely benefiting, and they're happy to come and have another session. So it's really neat. The other course that we have is called the Art of Self-Compassion, which is a course that looks at our own, how we treat ourselves, looks at the research around self-compassion, and again, lots of practical exercises. So in therapeutic touch, compassion is absolutely key. Dolores Krieger, one of the originators of therapeutic touch, she says if you're not using compassion, you're not doing therapeutic touch. And research shows that if we are able to be more compassionate towards ourselves, we are able to be more compassionate to others. So that is one of the courses in the certificate program, and had really, really amazing comments about that as well. We also have a course, Anatomy and Physiology for Body Workers. So as probably most of you know, Therapeutic Touch started with nurses, and now it's taught and used by all kinds of people in many different professions. And so sometimes people have a little bit of a, they feel a little bit uncomfortable that they don't know as much about the body. So I wasn't quite sure, to be honest, about whether we would include this or not in the program. But again, we've had a lot of really positive results. It's just really increasing people's confidence level. So we also have a choice of an elective. So the electives, there's 3 business type courses: how to start your own business, sales and marketing for managers in small business, or operating your own small business. So a lot of you probably know that sometimes we're really good at doing therapeutic touch or other healing modalities or caring for people, but we really don't have a business mind. And so one of the things that we wanted to do in this program is to give people the skills so that they can go out and do a career for themselves, and they do have the skills necessary to market themselves and to be successful. So that's one of the choices. There's only one elective, so you get your choice of this. For people who either have those skills or already or aren't taking this program for that reason, we also have the mindfulness-based stress reduction. So again, just a really great course looking into your own self, helping you to become more calm and more present. So I just thought I'd put in a couple of testimonials. I mean, people who do Therapeutic Touch, you already know all these kind of things. So this is around the Therapeutic Touch courses here that I've taught at Langara. Just a couple ones that they're really appreciative of Therapeutic Touch, of the classes. This one, Kamiko has said, you give me a greatest gift that I can spread out to the world. And another person, Francis, is heartfelt thanks and gratitude for an inspiring and rewarding mentorship year. But one of the things with the mentorship is that it offers people a chance to do Therapeutic Touch in different circumstances that they might not be able to do if we didn't have the program. So it gives them different opportunities. It also gives them a little bit of a schedule and a structure so that they can continue and they have goals, and we really have a wonderful group. So it's inspiring for everybody else. Also, another person, and she talks about having Therapeutic Touch after a couple of her surgeries, and also her son had several leg surgeries, and both of them commented about really decreasing the pain and increasing the relaxation. And this is our group of Therapeutic Touch students that are right now are in our mentorship program, and along with our supervisors are in there. So really neat, close group. So other ways that you can incorporate Therapeutic Touch into practice is really charting, documenting your sessions wherever you are. So you don't have to do like a complete documentation like you might do for yourself, trying to document exactly where there's imbalances in the energy field. But for instance, if you're doing soap charting, I know that there's so many different kinds of charting, but you could put the patient has high blood pressure or the patient is agitated or something like that, and then your action is Therapeutic Touch. And your response is the patient fell asleep or the blood pressure decreased or whatever. So just documenting that brings it into notice in the medical field. It's very neat. So another time when I was at work, it was quite interesting. As I did Therapeutic Touch, more and more people would see the benefits for their patients. So people would ask me if I would do Therapeutic Touch on their patient. And this one evening, I was working, and this nurse had asked me if I would. And so I said, sure, I would. And she no sooner finished asking me when the doctor of this patient had come around, and I thought he would be totally unreceptive to the idea. And this nurse, we don't need to have permission from the doctor, but she said to the doctor, oh, she said, Mrs. So-and-so could really use Therapeutic Touch, and Cheryl can do Therapeutic Touch on her. And he said, there's a study happening about that, isn't there? And she said, yeah, Cheryl's doing the study. Oh, that's really wonderful, he says. And he wrote an order for Therapeutic Touch for this person. So the point of that story is really to share what you're doing, because, lots of times at least for myself in the past, that I didn't really talk about it that much because I thought people might be negative about it, but really there's way more people that are so positive and supportive of the process, so it's really great. So other things is maintaining your membership in a local Therapeutic Touch organization. There's the Therapeutic Touch Networks of Canada that's listed here. Their website tells you all of the organizations across Canada and gives you links for the international organization as well. Also, consider belonging to other organizations such as the Canadian Holistic Nurses Association that really supports this kind of work. Of course, treat it as a profession, which rightly it should be. And we have developed through Therapeutic Touch Networks of Canada, I'm on a subcommittee, we've developed a letter to have Therapeutic Touch covered under our extended medical insurance providers. So we have a letter to give out to clients or family, friends, anybody, and it's just asking the insurance corporations to cover therapeutic touch. And what's happened in the past in other modalities is that if they have a lot of people requesting it, then they will consider covering it. So that's one thing that can be used, and maybe for other modalities too, you might consider doing that. Also, through Therapeutic Touch Networks of Canada, there is a group insurance plan. So it's the cheapest insurance that I have ever seen. So you have to be a Therapeutic Touch practitioner registered in your own local Therapeutic Touch organization, and you have a really great premium. And also, for another small fee, it will cover many other modalities as well. Theory of healing. So Dolores Krieger and many other people, Marianne Hadley for one, have organized, it's called Therapeutic Touch Dialogues, which is in Montana, and a group of people meet every year. There's roughly usually about 40 people every year who meet and are developing a theory of healing using therapeutic touch as the basis, but it is developed so it can be used with many, many different modalities. And so that is a working theory of healing has been developed now, and that is just in the process of being spread out and trialed by a number of different groups. So anyway, hopefully that will also help to promote the integrity of therapeutic touch. And also just remember to promote therapeutic touch in your community. So through our organization, we volunteer and do cancer runs, and we're at health fairs and different activities. So it's always great that people are introduced to therapeutic touch. Well, this is back to our Therapeutic Touch dialogues where we've developed the theory of healing. So here are some of our practitioners from Canada that are there. And if you have, I'm going to just move along to some of the questions here. But if you still have questions after we're finished, there's my contact information, so I'd be happy to try and help you. And you can email me or whatever. So I'm just going to go to some of the questions and see if I can answer them. So I know that there have been a few problems, technical problems. Let's see. Oh, ask if I can talk about a bit about where to learn therapeutic touch. As I say, it's taught in many different places through the individual networks, and Therapeutic Touch Networks of Canada will give you, as I say, the individual networks. But if you go to the websites of the individual networks, they usually have a listing of the courses that are being offered. So they're taught in many different places, as I say. Sometimes they're taught specifically to hospices or a particular group, and often they're taught through continuing education groups, or as I say here at Langara, we have what I think is just a wonderful program that's very comprehensive. So many different places you can look. Check those websites out and they should be able to help you. I'm just looking for another question here. Okay, will you be doing a certificate of completion for this course? For a webinar? Nope, you just get to enjoy it. Uh, I think that's all the questions I have. Here I see lots of questions about a few problems happening, but I think that completes the I think it completes the questions. So I've really enjoyed being with you, and thank you all for participating, and maybe we'll see you another time. So thanks again. I'm just waiting for somebody to turn me off.
That's okay, I'm just putting a little bit of an ending.